Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp on 922681060. My dear friends, as you know that we are discussing the different health problems and Ayurvedic perspective regarding that particular problem. Today's topic is traumatic arthritis and Ayurveda. Actually, it is a post-traumatic arthritis, I can say. So, but in general, we can say post-traumatic or traumatic arthritis, and which of the best medicine that you can apply as a paste externally, that is Dashang Lep. Actually, the link is given in the description, so you can demand this particular medicine through the internet as well. Now, let us start to discuss about this traumatic arthritis, which the real name is post-traumatic arthritis. Post-traumatic arthritis is an inflammation in a joint which develops after a traumatic injury to that particular joint. So naturally, this is a degenerative type of arthritis which occurs due to wear and tear of the joint. Usually, degenerative arthritis, that is osteoarthritis, takes a long time to develop. But when you have an injury, wear and tear on your joint adds faster. Post-traumatic arthritis develops in weeks or months rather than years. Fortunately, this sort of damage usually is not permanent, and post-traumatic arthritis can be a temporary phenomena. Most of the people recover in a few months with home care. But some injuries can do more damage than others, and sometimes post-traumatic arthritis becomes a long-term, that is, chronic condition. Though it is rare, some people may need surgery if the symptoms are severe and that are damaging your quality of life. So what can be the traumatic injury? Which type of the trauma is expected? During the car accidents, sports injuries, fall, common type of injuries that can affect your bones and cartilage include, these are the injuries. Fracture is a type of injury. Dislocation is a type of injury. Sprain is also a type of injury. Then naturally your doctor will diagnose post-traumatic arthritis with a physical examination and some radiological investigations. What doctor can do during the physical examination? He will move the joint and ask the patient about his symptoms. And then he can compare the patient joint, right and left, and its range of motion to what it was before your injury, and if possible, he will ask the compare before and after. After the physical examination, the doctor may ask the patient to do X-ray of that particular joint, MRI or CT scan. Post-traumatic arthritis treatment policy. There may be some prescription of the pain relievers, can be called as analgesics, wearing a brace to support that particular joint. Then afterwards, physiotherapy is very important. And if the patient is obese, always weight loss is the important step to control this post-traumatic arthritis. There may be some surgical procedures are required to do for curing these post-traumatic problems. For example, first doctor will do the arthroscopy, then joint fusion, that is arthrodesis, joint replacement, that is arthroplasty. Now, during this traumatic arthritis, post-traumatic arthritis, in Ayurveda, it is mentioned as agantuja vyadhi. That means occurring because of trauma, that is agantuja. Then one can apply the Vishagarbha oil to the affected joint, and then fomentation is given. If there are no visible injuries on the skin externally, then one can apply curcuma amda, specific type of turmeric, with lime. If this is not available, simple turmeric can be used with lime. It should be applied as a form of paste. Then internally, the patient is advised to take tablet Triphala Guglu, 250 milligram tablet Guduchi, 1 tablet. So totally this 2 and this 1, 3 tablets, 3 times in a day with warm water till the pain in the joint disappears within a couple of days. Then afterwards, tablet Ashwagandha as a rasayana or the tonic to the bones and muscles and ligaments. 250 milligram tablet, 2 tablets, 3 times in a day for 15 days as a rasayana or the tonic. Basically, whenever trauma occurs, according to Ayurveda, Vata bioenergy gets disturbed. So Vata vitiation is the predominant factor in the pathogenesis. If there is no visible injury on the skin, then external application, just now I have mentioned, that is Amra Haridra, Kurkuma Amra with Churna, airline is beneficial, that we have already seen. Apply another ready-made liniment is available, myostal liniment or Vishagarbha oil, and then as usual fomentation. So Snehana oil application and Svedana fermentation is the standard management for Vata problem. Triphala Gugulu, this is an analgesic anti-inflammatory, along with Septiline or Sukshma Triphala with warm water 3 to 4 times in a day. This is the best management for post-traumatic arthritis. If the joint is swollen, edematous, without any injury, apply the paste of Dashang Lep or paste of Kukkutanakhi over the joint. Prevent this particular problem like a post-traumatic arthritis by taking following these type of the measures. Always wear your seat belt when you are driving. Wear protective equipment for all activities and sports. Make sure at your home and workplaces free of clutter that could trip you or others. Use a stool when you need to reach something. Don't stand on chairs or tables or countertops. My dear friend, this is all about post-traumatic arthritis. If anybody of you having physical or psychological health problems, you can definitely take the advantage from the expert team of the Ayurveda Academy by paid online consultation just by WhatsApp 9226810630. Disclaimer, I always insist that these are all informational videos. So, as and when physician or qualified health providers' help should be taken by the patient. My dear friends, I would like to request all of you to like this video, share this video, and don't forget to subscribe YouTube channel to get the notification of such type of the interesting videos. I wish all the best. Take care. Thank you very much.